you. Well, let me first explain that by no means am I an expert on acupuncture. I actually volunteered to do this lecture because it's something I wanted to learn more about myself as a family doctor and how I can better use this. And I have a lot of patients who I think can benefit, and patients ask me about it. So I've kind of put it together in a way that I can understand and you can understand, and hopefully we'll both learn something in the process. So. And then at questions, or at the end, we can take questions and talk candidly, because it shouldn't be too long. So what is acupuncture? It's actually it's extremely thin needles. I think everybody knows that it's needles into your skin, and that's what kind of creeps everybody out. But they're so thin needles, almost like a mosquito stinger, not much bigger than that. And they go through your skin, and there are special points on the body. These points are called meridians, and those are pathways of energy that run through the body. There's 12 basic organ meridians, and in Chinese medicine, which we'll learn about, they attribute those to certain organs. So acupuncture points are all run along these meridians that the people who do acupuncture know. And the needles stimulate nerves, and they increase the blood flow and rebalance the energy flow. This energy is called qi. You'll see it spelled C-H-I, and you'll see it spelled Q-I. But it's called qi, and that is this nebulous concept of energy that runs through the body. And how acupuncture is believed to work is to redistribute, reharmonize, rebalance this energy at certain points that are connected to certain organs, depending on what your symptoms are. So where does it come from? Acupuncture itself is traditional Chinese medicine. There's documentation of acupuncture at least more than 2,500 years ago. And it's usually used in conjunction with other techniques. Chinese medicine isn't just acupuncture. There's herbal medicine, and there's Tai Chi, and there's things called cupping, and a lot of other things that go along with acupuncture. But this is a practice that has been established and been used for thousands of years, and really hasn't changed that much in the interim. And when you think about antibiotics, which at least I have, we've had them since I was born, and those have been only around 100 years or less. So in the grand scheme of time, things that we take as solid medicine and evidence, acupuncture has a much better track record than most of the stuff we do today. So what is Chinese medicine? When Chinese medicine looks at medicine, it's a much different concept than what we're seeing. Chinese medicine looks at the body as a small part of the universe, and everything in Chinese medicine is subject to universal laws and principles of harmony and balance. It rebalances energy, not just with acupuncture, but all the techniques and everything done is all about energy. Chinese medicine believes that all the emotions and mental states are very influential on disease. So it takes a lot more into account than most of Western medicine as far as people's emotional state, the anxiety that goes with certain diseases or symptoms, maybe fatigue or changes in your actual body energy. And the focus is on the body, it's on the individual, and correcting the body so it can prevent and fight disease. And that's a big difference. Is the focus isn't on the symptom or the disease. The focus is on the body and how to correct the body and get rid of the disease or symptoms. So what is that qi, or that qi, also pronounced qi? That's I guess the Chinese spelling of it. That's not a form. It's the fundamental life energy of the universe. If you look this up and you Google it, there's several different definitions, but it's basically an invisible vital force that creates and animates life. So people don't have qi, all animals and humans. And it's believed that there are certain pathways through the body called meridians, and that this energy is in all of us, and refocusing and changing that with acupuncture is how it works. A lot of nebulous stuff that we just have to have faith in because nobody proves it. But when you go to Western medicine, which is what we do in this country and what we've all grown up with and learned, we focus a little bit more not on the mind or body, but on the disease itself. Mind and body energy we kind of treat with pills, at least in the last 20 years, since we've had a lot of pills for mood disorders. We really focus a lot on disease. We cure infections with antibiotics. We look at heart disease, and most of the treatment is based on stenting open arteries and doing surgery to unblock arteries, and not on the disease that caused the blockages in the first place. So we believe that, you know, disease is caused by external forces, and we're always looking what causes cancer, where's the cure, and this is what we're looking for instead of what's inside of us. So alternative medicine is a big broad field, and that means anything that is not traditional Western medicine, which is what I learned in medical school, and most of your doctors went through medical school and learned. Alternative medicine can be Chinese medicine and acupuncture. It can be herbs. There's a lot of, I know, thyroid doctors out there now. There's a lot of different people. But the thing is despite everybody's belief and want for pills and surgery, Americans spend thousands of dollars every year. I mean, I know probably everybody in here has been on some supplement that's supposed to help with energy or fatigue or sleep or libido, or, you know, we've all taken it, B12 supplements, and this. There's always something that we want and we believe. Those count. But 83 million adults have purchased some form of alternative medicine. And this is purchased. This is out-of-pocket money, not co-pays or insurance. And there were $34 billion spent out of pocket on alternative medicine. So what this says to me as a doctor is that this is kind of important to people, and this is something that, you know, maybe we should look into and learn more about. I'm gonna get back to that in a minute, but remember the difference between alternative medicine and Western medicine. And we're going to talk in a minute about integrating the two. And you'll see a lot of focus, and I think in the next 10 years in medicine, you're going to see more and more doctors who have done a fellowship in something called integrative medicine, where they're pulling in Chinese techniques and some of these older things from thousands of years ago and working with what we know now with what we call evidence-based medicine. But why acupuncture? Why? I'm going to ask you afterwards, because I want to know where this came from. I know acupuncture, I was told, was something that everybody wanted to learn about. Usually, and especially in this country, it's used for pain treatment. So why do we need pain treatment? Because as a family doctor, that's my hardest thing to treat. What are other pain treatment options that we have? Well, there's non-opiate medicines. You'll see them all over TV. Cymbalta, Lyrica, Neurontin, gabapentin, Elavil or amitriptyline. These are all medications we use for pain, chronic pain. Now, a lot of times you may be on them for something else because they're also used for other things. We have physical therapy. We do lots of physical therapy, sports injuries or rehabs after knee surgeries. We have surgery. We do lots of surgery for pain, for neck pain, back pain, joint pain. We can replace it or cut it or realign it. We do that. Chiropractic treatment. That's a big pain treatment in this country. It works with realigning the spine and readjusting the pelvis and taking pressure off nerves that may be causing pain. Yoga is a treatment option, maybe more of an alternative treatment option for pain. But opiate medications, is this a laser? Yeah, right here. Opiate medications, biggest one that is used in this country, and you're going to see on the chart that since 2000, which is when I finished residency and started working in Liberty, the amount of opiate medications written by doctors in this country have tripled more than 4 times. And along with that, the amount of drug addiction treatment and the amount of overdoses, unintentional, from prescription medicines have also gone up 4 times. So that's why it's important to look at other methods. I'm on the Pickens County Drug Abuse Alliance that Dr. Mahane started. And this is a group of doctors, nurses, community members, behavioral health people who are focusing on this big problem that we have with overdose and addiction. Some of you probably got to hear Dr. Mahane present some of these numbers earlier this year. But I wanted, for those of you who did not, to give a brief, because I just can't go on without sharing some of this information. In Pickens County, we have about 30 overdoses every year, and these are not suicides. Most of them are not people who are out on heroin and cocaine. These are prescription drug overdoses, and many of them are unintentional. They're more on opiate medicines, which are Lortab, Percocet, oxycodone, usually mixed with some type of ADD medicine or anxiety medicine like Ativan, Valium, Xanax. And in Pickens County, 30 is kind of a nebulous number, but put that in perspective, I think there were only 39 accidents all combined, so that meant only 9 more that were motor vehicle accidents, drownings, fires. So when you look at the death, all of our accidents combined, this has been consistent in the last 3 to 4 years in our county. In South Carolina, we are known as a red zone. The Inspector General looked at the data from the whole state, and there were, I think, 256 overdoses in 2011 of prescription drugs, and Pickens County was 18% of them. So out of the whole state, I don't know how many counties we have, but almost 1 out of 5 people who overdosed in South Carolina did so in Pickens County. And so that's why this is a need and why we need to look at other methods of pain control. Of course, with opiates, you get dependency and addiction. That's been known for many years, and as doctors in healthcare, we like to think that we can control that and that we can select people who aren't as tendency to that, but we're still seeing it. A lot of teenage use. Teenagers get the medicines usually from grandparents, family members. Somebody has got it, they'll just take a few to themselves out of the bottle thinking no one will notice. People are now even getting those, I've heard of realtors saying that people are going to home showings and just to go through medicine cabinets so they can see what they can find. So when you look at the numbers, opiates used, it's now 4 times the amount from 2000. It's gone up every year. And in the USA, my computer crashed last night and I couldn't get the exact number, but out of the whole world, the use of opiate medicine, that's morphine, oxycodone, Lortab, the USA consumes like, I don't want to give a number but it is an inordinately high percentage of what we use when you look at other countries in the world. I mean, we are America and we want our stuff, and obviously we get it when you see the chart. It's alarming. So this is just to show you real quick, I know you can't read this, it starts back in 1970. This chart only goes up to like 2008. The numbers I think in the last year may have leveled off, but this is the rate of drug overdose deaths, unintentional, and I think this includes cocaine and heroin because you see it's pretty steady back here in the 70s and 80s when those were the big drugs of choice. But about 1990, 95 when really when a lot of these new medicines came on the market, and we had more than just morphine and they were prescribed. The drug companies have been selling them, and we have 8 times, actually it's up to 8 now in 2008. So back to acupuncture now that I've all scared you all to death. What is the safety? Because this is why opiates are not safe, and a lot of the methods we have, even the other pills, I know you've all seen commercials for Cymbalta and Lyrica, and what does everybody say at the end of the commercial? Please tell your doctor if you have any of these symptoms, and then that's the 30 seconds of side effects. So what about acupuncture? Infection. There's always, you put needles into your skin, we worry about infection. Well, in this country, and particularly in South Carolina, you cannot do acupuncture, at least with a license, without using sterile disposable needles. And when it's done properly with that technique, infection is almost 0. I mean, it's just really not something that we even need to worry about. Lung puncture, again, very rare. Theoretically, you have a very thin person and you're doing pressure points along the back or near the lungs. You go too far with too big of a needle, you could puncture a lung. Again, that's extremely rare. But the other side effects, maybe some soreness, maybe bruising at the site. You could have a headache or a temporary increase in symptoms, but that's it. There's no other side effects. There's no other safety. So really, it sounds scary. I put lung puncture up there. I thought I was going to scare everyone, but you look at that and you look at the side effects of aspirin, which how many of you in the room are on aspirin? I would guarantee it's probably over 60% of us take that. This is a very, very safe method. All right, so how did it get to this country from China? Just a little history, because this was interesting to me. In the 70s, President Nixon went to China, and I believe he was the first president to visit China. He took along with him a journalist, and the journalist happened to get appendicitis while he was in China and had to have his appendix removed, and he got to see firsthand how the hospitals operate. He saw people using acupuncture for operations, and he actually used it for post-op pain that he had. He came back to this country and wrote about it, and a lot of journalists picked it up, and that's how it started to get presented to Americans. So then in 1997, NIH is the National Institute of Health. That recognized acupuncture as a healing option in the United States. So National Institute of Health is our organization that looks at therapies and medicines and gives their consensus statement. So when that recognized acupuncture as a healing option, then we saw a lot more licensing options come along and not more options for people to use. So today, Eastern medicine or Chinese type medicine is gaining more acceptance, and especially when used along with Western medicine, and that's what most of us call integrative medicine. A lot of physicians who go through their traditional medical school are going back and getting training with a lot of the practitioners who do Chinese medicine and are learning some techniques and figuring out how to do two together. We're very good at treating infections, and acupuncture does not treat strep throat. It doesn't get rid of bacteria, it refocuses energy, but maybe it'll help fix your body so your immune system's better and you're not getting that as often. So, being that we do Western medicine and that I do evidence-based medicine and consider myself a scientist, you know, what does the research say? You know, can we just take it on blind faith that all these people for thousands of years have said that it works? We kind of do that every day when we talk to our friends about stuff, but you know, if the AAFP, the Academy of Family Physicians, or the CDC, the Center for Disease Control, anybody's going to recommend something these days, they want studies, they want science. So over the past 10 years, 15 years, a lot of science has been done on acupuncture. The biggest difficulties have been, how do you do a trial? You do acupuncture on one person and you don't do it on another person, they're going to know which one got the acupuncture. So they've been trying to design trials where they put fake needles or they do sham acupuncture, and it's been very hard to design. But when you pull all that together, the research shows clear benefit for certain areas. Post-op pain, one of them recently. Controlling pain in particular locations after operations. Chemotherapy-induced nausea and vomiting, big area, a lot of evidence and a lot of studies that clearly show a benefit compared to traditional just medication for nausea and vomiting. Probably enough evidence now on pregnancy-induced nausea, also safe to use in pregnancy, unlike a lot of our medications. And just last year, they added chronic back pain to this list, and that's a big thing because that is one of the hardest things to treat and the hardest things to live with, I think, for people who have it. And that has been shown. I went to a lecture in Philadelphia last October, and the research had just been enough new studies that came out in 2012 to kind of bump that over, that there are enough studies that show clear benefit on that. These items, they're promising results, but there's really not enough studies and not enough data for the science community to say, yes, this is better than not doing it. So we know that it may help and it doesn't do anything bad, but knee pain, migraine, tension headache, cancer pain, tennis elbow or lateral epicondylitis, prostate pain, pelvic pain, menstrual cramps, labor pain, this has been used successfully in labor, irritable bowel syndrome, which can include constipation or abdominal pain. Now, WHO is the World Health Organization. They're kind of the world's version of the AMA. We always listen to the AMA, American Medical Association. World Health Organization is from doctors all over the world, all specialties, family doctors, surgeons, other doctors. Now, they indicate acupuncture for all of these things. So a lot more, you know, we're a lot pickier in the United States. We maybe don't advocate everything that the World Health does. But so these are other areas where the World Health Organization says that acupuncture can be used safely and may help. Interesting on here, acupuncture facelift. I'm curious as to what that is, and I'm all for it, but I don't know anything about it. So if anybody ever has one, please come tell me. Scar reduction, insomnia, impotence, infertility, stroke residuals, which I take that to mean that would help some of the weak areas in improving blood flow and energy to those areas. Memory, that was my talk last year. And then just real quick, I don't know a lot about ear acupuncture, but a lot of acupuncturists are limited, and they may only do acupuncture. There are, I don't know, I think there's more than 20 points on one ear. But those points are used for drug addiction and alcohol addiction and ADHD, and there's getting to be a lot more studies on treatment in these areas. So if you go for acupuncture, say you've read all this evidence, you have back pain, you're not doing well on your current regimen, I'm going to go try the acupuncture. The biggest thing you're going to be out is money. We've decided that it's safe, so you have to decide the cost is really the only thing you're going to be out in your time. So what time is involved? Well, I looked at all the local acupuncturist websites, and you have to fill out a bunch of paperwork before you go, pretty similar to coming to a new doctor's office. They'll talk to you, hear all your problems, all your complaints, all your symptoms, expect about 1 hour. They look at your pulses and your tongue too, because there's a lot of Chinese medicine looks at the tongue to see different shapes and different patterns correlate with different meridians. They might recommend 6 or 12 treatments over several months, similar to what you'd have with physical therapy or with a chiropractor. And most, depending on what your ailment is, usually it's only 5 to 20 needles, not like a whole stick pin like I was picturing. When they insert the needles, most people will feel an ache or a tingling sensation, but not pain. Most people, the needles are so small, people don't feel them going in, but they may feel some type of pressure. And they say that that's when it works, when they're to the right point where it's going to help you and affect something, is when you'll feel something. The acupuncturist may move or twirl the needles to get them into the right spot. Some go deeper than others, depending on the spot. And they'll leave them in for 10 to 30 minutes, depending on, I guess, how bad your symptoms are and what they're treating. And then they just take them out and you're ready to go. There's no pain when they come out. So, does anybody have any real quick questions before I show you the video? Because I'm going to show you a video of somebody getting acupuncture. All right.
Acupuncture is a complex branch of ancient Chinese medicine, but its practical principles and methods are easily understood. 14 major energy channels called meridians course through the human body, including the head, arms, hands, legs, feet, torso, and internal organs. A subtle energy called qi circulates via the meridians to all the parts of the body, even the most remote cells. Qi is the vital force, the presence of which separates the living from the dead. Its balanced, unimpeded flow is critical to sound health. Any misdirection, blockage, or other derangement of the amount, flow, or balance of qi may result in pain, dysfunction, and ill health. With acupuncture needles or other means, the acupuncturist stimulates certain points, acupoints, along the course of the meridians. Such stimulation helps restore the normal balance and flow of qi, so organs and bodily systems can work together in harmony as intended. This sets the stage for the body to repair itself and maintain its own health.
So do you have any specific
The first thing the acupuncturist will do is get a little bit of information from the patient about why she's there and describe what she's going to be doing in the session.
Just let yourself relax.
She first checks the pulses, and this gives her information about how the energy is flowing through the body. So she'll spend a good amount of time feeling to see if the energy is too high, too low, and that's going to help guide her treatment. And of course she does it on both sides to see if the two sides of the body are balanced.
Okay, could you just
Now she's looking at her tongue. By looking at the color of the tongue and the quality of the tongue, that's going to give the acupuncturist information about the internal organs. And then she will also usually palpate different areas on the abdomen. And this is another way to check for energy blockages in the central channels. So overall, the beginning of the session is to just assess how the energy flow is and how the vital organs are. The body will actually tell her what treatment is needed. So she's having her turn over because she's going to put the needles into the back. The needles that she uses are sterile needles. They're single use only. They're all disposable. They're very, very small needles. She's going to swab the areas of the back where the needles are going to go with alcohol to make sure that everything is clean. She is explaining to the patient what she's going to be doing. Now what she's doing is counting vertebrae and feeling to find the exact spot where the points are, and she just taps the needle in. The acupuncture points are actually low voltage entry points. These have been measured, and the voltage is about 20 points lower where the acupoints are. So the needles are practically sucked in through the skin, and what that does is they go right into the energy channels in the body, into the meridians. So they have to be very precise about where the needles go in. If they're not in the right spot, they won't be entering into the energy pathways. Now what she will usually do before addressing a specific symptom is to first balance the entire energy system.
The meridians in the deep well in the body, what's called the yin energy.
And when she puts the needles in, if there's an area in the energy system and in the body where there's too much energy, an erythema or a redness will develop around the needle. It's like a pressure valve. So she leaves the needles in until all of the redness goes away, and then she knows that the energy has been balanced and unblocked. And you can see the patient is very comfortable. The needles, for the most part, are painless. There are some points that are tender, but usually the back is very painless, and it's actually a very relaxing treatment. And she's communicating with the patient as she's treating her to see how she's doing and how she's feeling, telling her what she's doing. There you can see the individually packaged needles, sterile, disposable, and just how very small the tip of the needle is. This treatment has been around for about 5,000 years. It was started by the Chinese. And now you can see she's checking the pulses again to see how the treatment is doing. She can feel a change in the pulses depending on how the energy is changing. So she has some feedback as to how the treatment is doing and how the patient is doing. And she can feel when the energy balances and corrects itself. And again, she always checks on both sides. So literally what happens as the energy channels get unblocked is the energy that flows to the organs and the different parts of the body gets freed up. And that restores health and it restores vitality. And in the process of that, symptoms will resolve. So she's checking the pulses. She's also looking to see if the redness around the needles has resolved. And that gives her an indication of when the treatment is finished and when to remove the needles. She may have found by checking the points and the pulses that there's some tension or blockages in the neck area. And you can see the client feels very relaxed. She's doing some energy balancing by putting her hand at the base of the spine. And she'll just let her lie there and leave the needles in while they continue to work to clear the energy. Okay, so she's checking in to see how she feels. At this point, the treatment is finished.
How are you doing? Great. Good. I'm going to take the needles
So
out.
she'll remove the needles, and they'll be disposed of. And then she'll give the patient some instructions as to what to expect and how she might feel after the treatment. She'll instruct her to drink a lot of water because it is a detoxification process. And now she's just going to let her rest for a few minutes before she gets up.
You look nice and bright.
Once again, checking the pulses to see how the treatment worked.
So when you come back for your follow-up,
Instructing her for
how that energy's held.
what to do the rest of the day, how to do some deep relaxing breathing, probably telling her not to exert herself or do anything strenuous for the rest of the day.
Questions?
second treatment, would you do more? Just asking her how the treatment went and how she felt. It all goes in your back, or how does that?
No, not at all. The second treatment, what we
Explaining to her what she found and what other treatments might be necessary.
We're listening to your flow of energy, and it's telling us what you need.
In modern science, I'll tell you, they are doing a lot of studies with MRIs and some phototherapy and measuring the areas of the brain that light up when needles are put in certain places. And this is how they're determining perhaps how acupuncture works or why. But it's believed in the Western medicine that what it does is when you stick those needles in the right spots, it activates blood flow to that area, and neurotransmitters, which are some of the same ones that opiate medicines work on, the endorphins, that it brings those to the area, and they've actually measured in people's spinal fluid afterwards the opiate type endorphin. So it does something similar chemically as what taking a Lortab does. So it kind of has that effect, except you kind of can't overdose on it. So say you've decided you want to do this, how do you find a practitioner? Who do you know, where do you go? Well, a lot of times ask your friends. If you know somebody who's been through it, and word of mouth is still a good thing. The most important is you want to find a licensed acupuncturist, and you'll see the title large L, large A, small c for licensed acupuncturist. In South Carolina, I went and looked up the laws. What does it take on the medical board to get a license for acupuncture? Well, you have to have taken a clean needle technique course, so you have to use clean needles. But NCC AOM is the National Center something of Oriental Medicine. They have a certification process. And this is a big deal. To become certified on this, you have to have about 3 to 4 years training at the master's level. Most people who have done this have been through some type of bachelor's degree, and they go on for training at a master's level. And they come out with 1,000 to 3,000 hours of clinical training in this. So that's the certification. Insurance companies typically don't pay for it, but as people like the AMA and are recommending this as a valid treatment now, we're starting to see some insurance companies pay. So check with your insurance company and see if they'll cover it, and if they have people that they recommend that they are certified. Some doctors can do it. Like I said, a lot of doctors are going to integrative fellowships and learning it. Now, I could do a course and do 100 to 300 hours and maybe do limited acupuncture for something that I treat. If you look at, if I'm going to go to somebody, even if they're an MD who does 100 to 300 hours versus a person who has 3,000 hours of training, I'm probably going to go with the one who has that. Now, the difference may be maybe a neurologist or somebody who really treats migraines, and that is specific, and they've learned those migraine acupuncture points. Then that may be somebody who really, knows everything about that one area and does limited acupuncture. And if they've got the certificate, then that's fine. I went online and looked up area acupuncturists because I've had a hard time finding where to send patients. I could tell you, and do we have those copies?
Yes, we do. We have some copies of that if anybody wants one at the back on your way out.
We have no one in Pickens County. Let me tell you, there is not one person, at least online or that I've ever heard of, that does acupuncture in Pickens County. The top one, I put him at top, Eric Oftenkamp. I've not met him personally, but he has worked with another doctor I know who had a practice up at the Cliffs and was really trying to do this integrative. So he has been kind of validated by one of my peers and felt to be very reputable. And I did email him a couple weeks ago, and he has just opened a new office, and he's in Greenville. So I would highly recommend him because I know about him. The other people, I've just looked at their websites, and I kind of like what they say. I think you need to beware of anybody who's trying to sell you more services and sell you supplements. There's plenty of that out there. It's all over the internet. Some of these people really focus more on acupuncture, but like I said, most acupuncture is offered with other things. Sometimes they'll heat up the needles or do a little electrical stimulation, similar to what we do in physical therapy. This person at Southeast Neurosurgical and Spine Institute. This is the pain management in Greenville. This is Dr. LeBlond, Dr. Shallcross, some of the neurosurgeons that some of you may have visited. I had heard that they had an acupuncturist, and I found this online. Now, I have plenty of patients that go to that office, and I've asked, and nobody has ever said they know there's acupuncture there, they've been offered it. So I don't know how you go about other than calling and asking, do you offer acupuncture? Do you have to see the doctors there first, or can I just make an appointment with them? But he does work with this very large group of doctors. Oh, thank you. I'm so bad. I do remember reading that. And then the other 4, I just looked at the websites. And this Clemson person I called this morning, and I didn't have time to take it off the slides, moved to California. So there is no one in Clemson, but they did have someone at Clemson Health Center who was apparently, I asked this morning, saw patients a couple days a week and was fairly busy. So if anybody needs to move to Pickens County, we have a need, I think. And then these are other websites and people I looked at, but this one didn't have a website, and I can't remember. There just wasn't as much information on these people. And there's boring references if anybody wants to know. And Thomas Edison has tons of quotes. I mean, we've all seen quotes by him, but this kind of interested me. The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease. And in my practice, that's kind of what I'm trying to get back to. And I think in the next 10 years, I hope we see a swing more towards prevention of coronary artery disease and prevention of cancer, and not just treatment of the ill effects of it. Acupressure is the same thing as acupuncture, except where acupuncture gets down to those energy levels with the needle, acupressure just uses your fingers to apply pressure. It's the same meridians, and it's the same points that are used. I don't know that much about it. I've gone to a couple lectures on acupuncture at some of the national meetings I go to over the years, and they've taught some, and I wish I could have used them more, but I know in the back of your neck there's a headache one I've used on a couple girls in my office who had headaches, and it really worked within about 10 minutes. What? Yes, there is one right here. I couldn't find it last night. I was trying to get that for you, but one of the other common ones is if you do the inside of your wrist and you take 3 fingers right at the line where your hand is, and you go up above 3 fingers, and just above that, that is an acupressure point right in the middle. You'll feel a lot of ropey tendons in there, but you can use 1 finger or a thumb and press right there. That is a nausea point, nausea and vomiting.
There's a band for seasickness that uses
Yeah,
that pressure.
and I have one of those. And that's very common. You'll see people on cruises walking around with the wristband that's got like a little stud right there that presses on it. When I went on my first cruise, I was pregnant, and I never had been seasick, but I had some nausea, and I wouldn't take any medicine because I was pregnant. So I got that, and it did work. It worked for me. But this is something, if you ever feel nausea or whatever, if you're sitting in a meeting and you have to hold it for 3 minutes. It's not something that you just push a button and it's better. It's not like taking a pill, but if you just are sitting somewhere watching TV and you hold pressure, you want to hold pressure not until it hurts, but you want it until it's a little bit uncomfortable. So you really got to get down in there and press so you feel that you're pressing pretty good. If your finger gets tired from the other hand that's pressing, just do that and then go back to it. But you want to hold it for at least 3 minutes or a little bit longer, and that's acupressure. This one, I'm thinking this is nausea too. I know there's one right between the bones of your finger and thumb. Does anyone know, is that nausea? I'll take you. Headache. Okay, that's another headache one. And you can squeeze, I mean, you can feel the area there. On me, that's a little bit uncomfortable. A lot of times if you have whatever the symptom is in that area, you'll feel more discomfort. Like, I don't have any nausea, I don't feel anything here. I'm more of a headachy person, so I probably feel it. And then the other thing I could just share with you real quick is Tai Chi, another Chinese movement. But this is something that I've started recommending to patients, especially with pain and with arthritis, because I'm constantly trying to get people to exercise, and I've found that so many people have either obesity or joint problems or back problems or whatever have gotten over their life so stiff that they can't do an exercise class. I mean, we can't expect people to, I know you've all been told by your doctors at some point, you need to exercise and you need to lose weight. Go to Join the Y. Well, you know, they have seniors classes and they have stuff, but most people cannot just go to a 1-hour class and jump in there when you're that, and the people who are more severe are the people who need to do it more. Tai Chi is something that no matter how old you are, no matter how debilitated you are, people can do this and you do it to your level. As long as you can stand up for about 10 minutes, you should be able to do Tai Chi.